Going live. And we're live. So, Ron, we're actually, people are able to see. Well, you can see how many are watching now. I don't know if you can see the number. It's 0 when it starts. But as soon as the notification gets out, a lot of people will be coming and watching. I would guess it's going to be a couple dozen that'll be watching as we clean out your ears and freeze that lesion off your nose. So for the people who are watching this after it's recorded, we should let them know we'll be talking to people that are writing comments on here, asking questions as we go, and Ian will help us with that. There, okay, now they're starting to come in, so there's 32 of them already. Welcome to Ron's Ear Cleaning and Nasal Lesion Cryotherapy. I'm not sure on the lighting in this room how well this is going to work. Yes, hello Maria D'Angelo, we see you there, and Butterfly Girl, we see you too. I'm gonna turn the camera around. There's a way. Have you seen how this button allows you to switch like that? So that then I can go like this, and we're looking right at that spot there. It keeps coming back. It could be cancerous. It is rather small, so we're able to go ahead and use cryotherapy or the liquid nitrogen to burn it off this time. If it comes back, we're going to do a skin biopsy on it. And then you guys probably want to see in the Ron's ears here. Let me put on the adapter so you can look in ears. For people just coming in, we're putting on a special instrument that allows us to look into Ron's ear. Oh, you know what? We've never done this live before. We've never looked in the ear live. I don't know if it'll let us use the light or not. Oh, you can use the light flash. So here we go. This is the right ear. And it is just packed with cerumen. So we need to do something to get that out. We'll go on around to the right ear. Thank you, Ron. Ron corrects me. This is his left ear. He's been keeping his left ear on this side, so most people do. All right, yeah, you can just see that there's a lot of cerumen on this side also. All right, let's take that adapter off. Keep it nearby because we're going to need that. Kind of set this up on the corner while I do the cryo, and Ian gets the, well, you can't hear me if I do it that way. Let's switch this around. Ian gets the water ready, so you might be hearing some of the water.
We got one filled already, right?
Oh, this is filled up. Okay,
yeah.
All right.
Tip and
Well,
everything, yeah.
we can go ahead and do that and then do the cryo afterward. Let's grab, oops.
Oh, wow, I've never seen that break.
Popped my C41 apart here, so let me, complicated showbiz terms. There, now it works. Oh, you got that for me? Thanks.
Yeah.
So we'll start on this side, Ron. Let me get the, oh, that works. Oh, we're out here. All right. And I'll have you hold this right there. This is going to be kind of loud, I warn you. And it won't be too hot. All right, here we go. Okay. Are you laughing? Oh boy, we got stuff now. Go ahead and grab your camera so we can Alright, so there's some wax coming out. Let me turn this around. You can already see all of that. Oh, you can put, yeah, go ahead. There you go. So you can see some of that. I'm going to put some more water in. It's coming out through the device there. Let's let some of it go by. Oh, sorry, I didn't hit you guys. Alright, so I'm going to turn this off. I'm going to take this away, and we'll start doing some manual cleaning there because that's just pouring out.
So they were playing jackhammer music going.
That's kind of what that works like, yeah. You want to put it down there? Okay, I'll put it down there. Can you tell any difference?
Yeah, a little bit.
Can you hear any better?
Yeah, I can hear you.
Well, let's go in and see.
How do you turn the light on with the thing?
Oh, the light?
Yeah.
I don't know, maybe it's on. Nope, it's not. So the light, you would go to
Is it that thing?
enable
Oh,
flash.
gotcha.
We'll throw this on, and then we'll jump into the ear.
Jump on in.
I'm going to
Okay.
take it off of this because I can't get
Okay.
in here with that.
Yeah.
Okay. Cameraman needs better lighting. Hey, we're just doing this on the fly. We don't have studio lighting on this one. All right. Then there we go. There's the eardrum with wax still in front of it. But it's pretty neat to be able to see it there. Just yeah. Okay. All right. So I'll put this over here. And we'll switch the camera around. Yeah, that's okay. Can you read what the comments are?
Yeah, let's see. I can imagine that must be the most uncomfortable
You can turn
feeling.
around, bring it over if you want to.
You will.
Oh, we need the thing. The reservoir.
That's right.
See, I know French.
There we go.
Yeah.
Here we go again.
Now you got 60 watching.
60 watching. Hello, 60. I saw his sibling was on there from Toronto. And yes, I'm doing it without gloves. I know that drives some people crazy. There, you see some pieces come out. I don't know if you saw those come out. Oh, that's better. Hey, whoever made that comment about the lighting was right. Oh, yeah, you gotta hold it closer, it's dripping. Glad you didn't wear your fancy clothes. Alright, we got some more out. So I'm gonna take that away. Is it hurting?
It's just when you do it.
Just when you do
It
it?
doesn't really hurt as much as just.
It's quite something to feel, isn't it? I'm gonna get a new tip for this since the other one fell on the floor. Yeah, I'll grab that. Almost saw the message. Can I ask what the name of your assistant? And can I get a hello? Okay, Ian, they want to. Some of the ladies want a hello from Ian. All right, Ian, give him a hello here.
Hello,
I can't get it. I can't get it to switch.
It's okay.
Okay.
Doesn't take much to entertain some people.
Isn't that something? How do you, there we go. There, he just gave the hello. Sorry you missed it. All right, switch this on. Make sure the light is on, and we're going to go back into the left ear. I know my left from my right finally.
Figure that out, huh?
Somebody's asked if that's a water pick. It is a water pick, but it has a special attachment on it. So at this point, we have that flake of wax really in the way. Somebody says hello from Florida. I think I can get that manually and then open things up. Because the eardrum down there, we got a really clean shot to that. That is looking good. Down and left and right are switched when we get in the ear. So it's actually the bottom you're seeing there, even though it looks like the top. And that can be scooped out really easily. So we'll do that. I'm going to scoop a little bit here. Okay.
Hands are dry.
There we go. All right.
Doing some scooping.
Yeah, I don't know if that will get any. This is. Oh, I see him making a face as I do that.
He has a lot of faces.
He has a lot of face. Let me just put that there for a moment. I never knew that ear cleaner
That
was so
eardrum
popular on
looked
live
great.
YouTube. 64 people watching. Oh, I hit that cough spot. Spot that makes you cough when you hit it in the ear canal.
You hit it all right.
All right, let's see if it's still, light's still in? Yeah. All right, we're going back in. Yeah, thanks for grabbing it. All right, here we go after a little bit of scooping. And we see that little spot, but where is the canal? Oh, the canal is way up there. It's hard to light it. Or, I'm sorry, the TM. A little red from the irrigation. That's pretty normal. As we come down, remember up is down and left is right on this. We see that little bit of wax down here. I'm gonna try to scoop that a little bit of wax out. Thanks.
Yeah.
It's. Let me see. Can I maybe bring that a little bit toward me, so the light can get back in there a little bit. No, I just wanna. I remember the wax was. Oh, sorry. White right there. Okay, I think we've traumatized your canal enough. Now, I know that there's going to be a lot of people watching this after the fact say, finish the job, there's still wax in there, but you know what it feels like when I scrape in there.
Yeah.
And we also know that the canal is clear to the eardrum, so I am not going to do that to you anymore on that side. We're going to move over to the other side and get started over there. And we'll switch your bib around to the other side. Go. And have you hold it here, and then are you able to do that, or I can pull the table a little bit this way.
I got it.
You got it?
I can see it right there.
You can tell that what's on.
Yeah.
Okay. All right, here we go. This is gonna be dripping. Let me get something to collect the drip. Water pick has a leak. There we go. All right, I'm going to have you move your hand for a moment because I need to be in like this. Can I have you hold it from the bottom and hold it against your head there? All right, we're going to find our way into the canal. Here we go. Brace yourself. Yeah, there's some wax there. Oh, a lot of wax. I'm looking at you because you can see his face. Expressive? Alright, let's take that out, and we're probably going to be diving in there to look.
Johnny's water torture.
Yeah, let's jump in. Yeah.
Yeah.
Alright. So I'll put this on so you guys can see what we have in the right ear. So there's certainly an accumulation in the canal. If I get past the opening and look further in, I can't see the eardrum. I can see where it's supposed to be, but there's just wax all over there. All right. People are commenting and having an argument about if hair color has anything to do with wax accumulation. Yeah, I'd never heard that one before. All right, where's my little, there it is. All right, let me just get that little bit out. Pull some of this out just to make the passageway a little clearer. There we go. All right, let's do another round. Hand off to Ian. Oh, you don't have your You were looking for your
Oh.
reservoir.
Yeah, I'm gonna see, I go.
You knew you needed it. All right. Here we go. We're making good progress this morning. On an early Monday morning. I can't tell if you're laughing or crying.
Just like, no, this is supposed to be sad news.
It's quite a sensation. Is it worth it? Oh, there's a bunch in there. It's
Does the noise like make you do?
At least I know I'm getting my money's worth.
yeah, that's right. All right, let's get that out. Oh yeah.
Ooh.
See, lots of stuff like that. Just we keep getting more and more and more. All right, so the canal is fairly clear. Oh, there's, I don't know if you guys can see that, but there's something right up there. Yeah. Okay, let's jump in. Let's well, there's wax on that, isn't there? So I'm putting on the adapter. We're jumping into the ear. What will we find? Oh, nice.
Can you see the eardrum now?
I can see the ear. Can you hear any better?
Yeah, I think so.
I would think so after that.
Think of another one?
No, I'm not going to do any more irrigation on this. This is, well, hold on. Let's see. What is that back there? I'm thinking we're going to leave that alone. Because that is one clear passage compared to what, you can see a little piece of wax in there. And I'd be glad to irrigate again if you want me to, but
Well, that's up to you, you're the doctor.
yeah, let's do one more then. We'll try to get that completely out of there. Rachel Neal says, yes, live action ear cleaning. Hi, Dr. Vaughan and patients from Port Elizabeth, South Africa.
I'm reading about South Africa right now.
Reading about South Africa? Somebody says, fantastic job. Oh, they're talking about how the ear looks red. The eardrum does look red, and if you watch this video, you'll be able to see it. That it's very engorged with some blood vessels. The whole thing isn't red. It's just where the blood vessels are, one part of it, and that happens when we irrigate. It gets irritated.
All right, there's your
They were arguing about whether that was an infection or not.
Well, the color of the wax, you always had that when you would like, just simple lines. Do a little applicator and it's pulling that color thing.
And they're saying the skin behind his ear has a red spot. Oh, yes, we're aware of that. That's something else. We're not going to do anything to that. It's benign. Okay, here we go. Are you able to get in? There we go. Ready? Does it feel better when I turn it down?
Yeah.
Makes a difference? Okay, we'll keep it down then. Yikes. Oh, sorry. Trying to catch the drip here.
Coming from.
Some is coming from there, some is coming from here. Just about done. Oh, right at the end I saw some come out. Yeah.
I think the warmer the water is, the better it feels too.
Yes, warmer water does feel better.
Yeah, there's some of those for you.
Yeah, it keeps dripping all over you there. Well, let's see if there's anything to kind of clear out here. No? Anything I can see just by inspection this way? No? We're going in. All right, let's put the adapter on to go live into the ear. Alright, so we see the eardrum. Looks pretty good. Not seeing the wax. Oh, there's that little piece of wax we were talking about earlier, but smaller. In fact, you can barely even tell it's there now. So we're going to leave your ears alone. And now move on to your nose. We're going to torture your nose for a little bit. I don't know if anybody's interested in some of the wax here. See, for reference, for size, that's a finger. That's my index finger. Another little piece over here. Do we have any over here? On the, or did you already take them away? They're all gone. Okay, so the nose, this lesion, we're going to get close to it again now that we have some light. Thank you, Ian, for coming up with light on this. We're gonna freeze that. It keeps coming back. It could be an actinic keratosis. It's possible it is a type of skin cancer, but it's small enough that we should be able to freeze that off. If it comes back again, we're going to biopsy it. We're not quick to go carving on somebody's nose. We're going to use the this tip here to freeze with. Ian's putting the fine small tip. We're going to show how that sprays here. Let me hand the camera over to you. So how many people are watching?
48.
48. Oh, what happened to our 60?
No, you got 50. Yeah, you had 60, 70.
The nose at 70 even at one point.
Yeah.
So I don't know how well you guys can see, but this is going to spray liquid nitrogen into the air, and it, of course, just goes straight to nitrogen into gas. And we're going to do this on the nose. Ron, you ready for this part?
Oh, yes.
You're getting so much done to you.
I know.
You're a good sport.
See if we can find
Thanks for
something
sharing
else.
with all the folks there, including South Africa. All right, so I like to get very close because I don't like to spray parts we're not intending to spray, and then here we go. You guys probably can't hear it that well because the microphone's turned the other way. I like to get just a little collar around it of white and have that stay for good nearly 20 seconds. And then after it thaws out, we repeat the procedure. So 2 freeze-thaw cycles, we get the best results of freezing off these lesions. Looks like it's ready already. So here we go with number 2, and then we'll check this again. We'll talk a little bit about the red spots here before we're done.
I hope your day is well, Dr. Vaughan.
Well, thank you. I hope yours is too. All right, that's staying pretty white. Okay, let's talk about the red spots. So if you look up here, at the hairline, it gets kind of reddish. It may be hard to tell on that camera. Up here, a little bit flaky. Now this looks very similar to actinic keratosis, and some of it can be. But you'll notice this pattern of it's where the hair is mostly, and it actually gets more intense as it gets under the hair. Let me come around the other side. Let's see, can you see any back here? Hard to see through the camera, but it gets more intense the more you get into, and it flakes a lot. There you kind of see the flakiness of it. So we have 2 things, or maybe not 2 things. There may not be much precancerous stuff going on the scalp. It looks more like seborrhea. Also, sometimes we'll see psoriasis even follows this pattern, although psoriasis usually looks a little bit different. It has real silver-colored scales on kind of a salmon-colored base. Really, really mild psoriasis could even look like this, but we would treat this first as if it's seborrhea, or a lot of production of skin oil, and that's actually what that flakiness is skin oil coming off of the skin. If you were to rub it in your fingers, the little flakes, instead of feeling dry, they actually feel oily. So we'll treat that with some, trying to come up with a name, it's an antifungal. I'm blocking on the word again. People who watch me all the time, they know I do this. I'll have to look it up after we finish the video. But it'll be a shampoo that you put on 3 times a week. And it's just a shampoo, you don't have to wear gloves with it, you just put it on. And that should clear this up pretty nice, and we'll check back as this thing on your nose is healing up in about 6 weeks' time. Now, did you have any special messages you wanted to send out to all your fans? Did you want them to look at your website, or see your upcoming show, or
Hope to have a good day.
or come to your business, or?
No, we're fine.
Okay. Thanks, Ron. I appreciate you doing this. That's fun. I'll have to do something else in the future. Well, I mean, I don't wish you to have another procedure. That's pretty mean of me to say that. Hey, until next time. Thanks for joining us here with Ron, Ron's wife, and Ian. Until next time, Dr. Mark Vaughan telling all of you to stay in good health.